Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this little bit of cloudy, a little drizzly May the 4th. And so May the 4th be with you. We have a really good program this morning. We have some really good guests. And, of course, we have Hawkeye, or shall I say, young Padawan, or Obi-Wan, or Obi-Hawkeye. How do we do that? We'll have to come up with a better word than that. We'll get there. I'll figure it out sometime during this thing. At least you're not the evil commander, I don't think, until you give the numbers. He'll be back with us today. We're going to run the numbers. We also are delighted to have back in the studio with us Dr. Carrie Weinecke, our chair of OBGYN. She's going to talk a little bit with us and with you about the risks of pregnancy, COVID-19, vaccination, newborns, lots of important topics. We get a lot of questions. Dr. Weinecke is an expert, so we are delighted to have her back this morning. So, Obi-Wan, how did we do last night?
Maybe we're just more like Jedi Knights, just trying to protect the community and the nation as much as we can.
That is what it is. I don't know.
We can only do so much.
If I am, I'm nearly retired. How's that? I did wear my Star Wars tie, so I did bring that in honor of May the 4th. I am a Star Wars fan too. I know I talk a lot about Star Trek, but in this case, Star Wars. May the 4th be with you and all that.
Yeah, no, we got it. We got it.
All right, I like it. Is this your new treatment for COVID-19?
This will not treat or prevent COVID-19.
Dang it! Then
but
what
vaccination
good
is it really?
does. I like that.
So the numbers, Hayes has one active patient, but I think more concerning for us in the metro, and especially here at the health system, we have 25 active infections with 6 ICU patients, but 5 of those on the ventilator. Still 10 additional in that recovery period. And I think some things to go through. We were able to get Amanda Cackler to be able to get some of the demographics. We only have one person that was fully vaccinated and has been admitted with symptoms, and that was a patient in their 60s. In addition, we do have age ranges from in the ICU from 38 to 56, and on the regular medical surgical floors, 23 to 81. We know and understand that those patients, none of those patients in the 23 to 81 on the medical surgical floors have been vaccinated. So
really, the story is vaccination works.
Yeah.
And even when you come into the hospital, usually with a COVID positive test, you're not here because of your COVID positive test if you've been vaccinated. We only have one person who's been vaccinated here with that. And we do know that sometimes there are underlying issues that a vaccine may not take, but the overwhelming majority have done just great. And if they are or if they do have COVID, they're usually asymptomatic. A couple of other things we heard this morning. First of all, the Washington Post is reporting from an anonymous source within the FDA that the data from the Pfizer-BioNTech study looking at children from the ages of 12 to 16 was really positive, and hoping to have it get their EUA next week, so which would mean we would be vaccinating 12 to 16-year-olds as early as late May, early June. So that's good news. We hope that it holds to be true.
I think that's good news if people are traveling for the summer. Obviously it'll be a little bit too late to protect them for prom and graduation, but moving into the next school year, if we can do everything that we can to try and keep children in schools as much as possible, keep it a safe environment so they aren't getting it there or getting it when they're doing extracurricular activities is going to be vitally important. And we know that we haven't heard a lot or any problems from these 16 and up getting vaccination, the side effects that we're seeing, we've seen in the older patients with adverse reactions, allergic reactions. We just have not heard that, even though we know that kids 16 and up can get vaccinated, and we know and we heard today that Children's Mercy is doing a lot of vaccinations, and everything has been going pretty well there.
Which is great. Yeah. And you get them back on the program and talk about how those efforts are. Hey, so another thing we heard this morning on our Chief Medical Officer call was that a number of hospitals are saying, their numbers are sputtering, kind of up a little, down a little bit. About half of the hospitals have seen a clear upward trend. There was one of the hospitals where we'd gone from 1 or 2 up to 30. We've gone from 7 up to 25. A number of hospitals are clearly seeing an upward trend, and that's before really the effect of removing the mask mandates and going back to full service in restaurants and bars really took effect. So just to say, I think we have to be very cautious about how things are going out there.
Absolutely. Yeah, we need to continue to do the things that we know work. again, just because there is a lift in the mandates or the restrictions doesn't mean the virus is gone. And we know how to protect each other from this. Again, outdoors is always better than indoors. Continue masking, especially in those indoor situations. Get vaccinated. Continue distancing when you can. And it's down to the individuals and groups to be able to do that.
Yeah, so true. So if the lightsaber doesn't really protect you, what about, is Darth Vader and Boba Fett, are they all still susceptible to COVID, do you think?
They are, I think.
And I think given the burn, things that we know happened to Darth Vader, he's probably at high risk of a bad outcome.
Risk, yeah.
So anybody with those chronic underlying diseases ought to be getting vaccinated,
right.
Even Darth Vader.
Continue vaccination.
Good points. Dr. Weineke, I know you've had a busy day. You set up on the labor deck, so lots of babies. What are you telling moms now about being vaccinated?
Yeah, so almost really what we've been telling them since the beginning. The first part is, unfortunately, we don't have any great direct data because the pregnancy was not included in the initial study. So we are still waiting for a few of the companies to enroll pregnant women in the secondary studies. But what we do know is that COVID affects a pregnant mom much more than a non-pregnant mom and increase those risks. So we are still highly, really talking about the vaccine with our moms. The CDC director last week did initially say recommend and then took that back a little bit just based on data, but no pregnant woman or breastfeeding woman should be withheld the vaccine. We talk about the risk that we know of COVID, of getting COVID to a pregnant mom, so increased risk of ICU, intubation, ECMO, and death. And then we talk about what we know about the vaccines, and there does not seem to be any safety signals from any of the studies out there with the COVID vaccine. So we have that discussion and really talk about what's best for the mom.
And some interesting things out there about the antibody or the vaccine helps produce antibodies that go into breast milk and across the placenta and protects the newborn.
Yeah, so there has been both of those initial studies that have published, some smaller data sets right now, but of course we have found antibodies in breast milk and then passing on to children. We don't know what that antibody level, kind of that magic number is yet, but we do find antibodies have been passed, as well as antibodies been passing in the cord and the placenta, so same thing. We don't know when that exact window is, but a lot more to come. And again, the biggest thing to me is really no big safety signals, right? So all positive things coming out, nothing really worrisome so far.
Yeah, that is really the best news. I mean, I don't think any of us could have thought these vaccines were going to be as effective as they are, nor to be as safe as they are, Hawkeye. Yeah. This is pretty revolutionary.
Yeah, we keep seeing further evidence of that, of the safety and of the efficacy, and even against these circulating variants as well.
All right, let's see if there's any reporter questions out there this morning.
Good morning, Cody Holyoke with Channel 9.
Hey, Cody.
Hey, how is he not Hawk Solo? I feel like that was a missed opportunity.
Oh, wow, that is really good.
Yeah.
I should have thought about Hawk Solo. Okay.
That's all right. You'll get it next year.
Cody, you win. You win. That's it. You win.
A couple questions. We talked about, and you touched on it a little bit, about restrictions going away. And there's this story that's been in the headlines about herd immunity and reports from health experts saying, we're probably not going to get there if things keep going the way they're doing as far as demand for vaccines. And my colleague Donna wanted me to ask, what shot do we truly have of reaching herd immunity if vaccination numbers stay where they are? What are your thoughts?
Yeah, I think the problem with herd immunity is that you need to have everybody be vaccinated and or have everybody get sick in a relatively short order. Okay, that last idea is a terrible idea, just to be clear, because we saw what happened when there was really severe widespread community transmission of COVID-19 to hospitalization rates here and in other parts of the United States, and now it's in India. That's a terrible idea. So the only real answer is to get everybody vaccinated, because otherwise, if you're thinking, well, I've had COVID-19, Hawkeye, and then you just say, oh, I don't need to be vaccinated, the reality is, A, you're not protected against the variants, which the vaccines do work with, and B, we don't think your immunity lasts as long as it does with vaccination. So if we don't get people vaccinated at a higher rate, then we really aren't going to achieve herd immunity because there's always this temporal problem where, you had COVID-19 a year ago, but you're no longer really protected. You could get it again and pass it on again, and that means the virus is going to replicate and mutate. And so, really, we're not helping ourselves. Thoughts?
No, I think your point about natural infection and immunity is spot on. There's good data signals out there that you don't have as robust immunity or for a long period of time with natural infection, especially mild disease or no symptoms at all. So we know the vaccine, at least from the durability experiments, but also looking at the antibody levels, and just as Dr. Weinecke said, we don't know the exact correlate of protection from the antibody levels themselves, but what it does look like is vaccine does offer a more robust immune response and a longer immune response compared to natural infection itself. And just remember, if we put this in the context of natural coronaviruses, the common cough and cold coronavirus, again, of which there are 4 that we know of and have been circulating for hundreds of years, we know that you can get reinfected with those common coronaviruses, a few months after an initial infection. So vaccine is definitely the way out of it, and we understand that it's really just a question of numbers and simple math. How many people are still susceptible to the infection, that can get the infection, that can get severely ill, but who can also spread it? And so if we can get more people vaccinated, and now if we are able to get that younger age group vaccinated, those are numbers of people that we can take out of the equation for being susceptible to the infection and also potentially spreading the infection.
Yeah, so the answer to this whole thing is to live long and prosper, even on Star Wars Day, and be vaccinated.
Heresy. Okay.
All right.
Here's a bit of a curveball for you, and this is just very unscientific from what I've been seeing around our workplace and hearing from friends and family. Are you seeing or hearing about patients with other ailments now start to crop up now that more people are getting back together? We talk about COVID all the time, but what about colds, viruses, things like that? I know several people who have called out sick in the last week. Did we give our immune systems a break with all this time apart?
Oh, I don't think we have to worry about our immune systems at all. They've been so well primed, and there's plenty of stuff out there. And I do think if you wear a mask, you're not going to get it. That's the key. If you weren't gathering as much, you're not going to get those kind of viruses. But once you start putting people back together again, people are going to share the common cold.
Yeah, and we know that there are other common viruses circulating. Rhinovirus, which is many different types of rhinovirus, which can cause the common cough and cold. We know that's circulating. Luckily, we didn't see a lot of influenza this year, but we know just other things are circulating as well. But unfortunately, we know also people that are continuing to get sick with that, but aren't getting sick with coronavirus, despite all the measures that we're taking. So,
great, thank you.
Thank you. Other questions? All right. So, Dr. Weinecke, would you get a vaccine if you were pregnant?
Yes.
Awesome. And so you feel pretty strongly that this is safe, it's protecting the moms, and everything. Have you guys had any bad side effects from it?
Not from the vaccine, no.
Okay, but from COVID-19, you've seen some bad things.
We have had patients admitted that with some severe disease in the ICU, etc. So yes, we have seen those. And
are you seeing? Because what we're seeing in the hospital, what we're seeing across the city, from our CMO call today, is that it's younger and younger folks. Did you see a lot of young people getting sick with COVID-19 before they were vaccinated?
We saw a lot. We had a very high number of people that were positive. Luckily for us, the majority of our patients were mild disease and a few kind of at medium level, few real sick patients, which was really lucky. Last week we had, I believe, over 30% of the positive numbers up on labor and delivery. So that was a little concerning. I was up on labor and delivery last week and sent an email, and we had 4 patients positive. So, that kind of just, I guess, mirrors our community reflection of younger patients. They had not been vaccinated. So we're seeing that. And so,
that's a concern. And then the babies, if mom's positive, she's sharing COVID-19 with the newborn, I assume. What are we doing around that?
So it's just common precautions. As long as mom has mild disease, masking, hand washing, those sorts of things. Just recommend the same social distancing we would with anyone else. Okay. Initially, when this first came out, over a year ago, we had, we discussed quarantining the mom and baby, because no one knew And those were our first recommendations, but we don't practice that anymore. As long as the mom is able to safely take care of the baby, then it's just, masking, hand washing, things like that.
So we're back then, Hawkeye, to the rules of infection control.
Yeah, absolutely.
All right. Let's see, Jess, what questions are out there in the public?
Okay, so Judy says, my granddaughter's doctor told her not to get the vaccine since she may want to have another baby. Does she need to be concerned? Why would her doctor communicate that? Is there any risk?
That concern. B, this whole thing about vaccines causing sterility. Can you take that on for us?
Yeah, so that there is no evidence at all about that. That actually, trying to research where some of these concerns
Theories.
come from are really interesting. But this one comes back from the concern that there's a spike protein in the ovary that is similar to the spike protein in the vaccine. Therefore, that if we give the vaccine, you will attack your ovaries and therefore render a female infertile. That has not been proven. That's been looked at. That has been debunked by our Society of Reproductive Medicine as well as the Society for OBGYNs. So no scientific data to support that concern.
And no male sterility from COVID-19 vaccines either. Just to say, just in case you were wondering, but if you're men out there listening, there's no male sterility either. So.
Okay, so Jane wants to know, what do you think about vaccinated grandparents visiting a newborn? So they're vaccinated, but should they still wear a mask around the newborn?
Well, there's no difference, I would think, versus anyone else. So if they are past their 2 weeks, follow the CDC guidelines of masking. If you're outside of your 2 weeks of vaccine.
Yeah, I think if you've been vaccinated, you want to go see that newborn, you're probably pretty safe, Hawk.
I would think so.
Do you need to wear a mask at that point in the newborn?
You are able to, if you are fully vaccinated, your household, you are able to meet with one other unvaccinated household. So I think that would be okay, a meeting with that household, with that newborn baby, without being masked.
So that would assume, though, that the mom and dad are vaccinated, though, because the newborn would not be vaccinated, right?
Well, you can, if you are vaccinated, you are able to meet with one other household that is not vaccinated, provided there is nobody at increased risk of severe disease in that unvaccinated household. But
it's kind of interesting. You look at that and it's like how they came up with that number. I'm not exactly sure.
I know.
think it was just they're trying to take a best stab they could at helping people get back to a little bit of normalcy.
Baby steps and seeing loved ones and all that.
All right, Tiffany says, what are your thoughts on all of this lifting of the mask mandates? Do you think lifting them helps or hurts the goal of getting more people vaccinated? Does it tell the public the vaccine works, or is it just setting us up for another spike?
Yes.
Yeah. Many different questions and answers to those questions.
So what do you think?
So as far as the mask mandates, again, we are looking at medical and public health guidance and information and data versus other things such as opening up the economy, getting back to doing what we used to do, constituents. So there are a lot of other issues there. But again, just as we said before, just because the mask mandates are lifted from the government or our elected leaders doesn't mean that other places can't do that. Private businesses, other entities as well can continue to, because even though those mask mandates are lifted, we still know what protects us in it. It doesn't mean that the virus is gone. The virus is still out there. We've seen that here locally, that our cases are increasing, both the daily counts and the rolling 7-day average. So you can still do those safe things. I think it also does lend to the fact that though vaccinations have helped, but we still need more people vaccinated. We still need those vaccine hesitant people to go get vaccinated for protection of you individually, for protection of other people that may be at risk. We know that especially people that are immune suppressed, for example, solid organ transplant patients, a third or more of those patients don't really mount an immune response despite having vaccines. So there are patients who are at risk that are out there as well. But also for you individually to be able to keep those things open, keep the economy open, continue to be able to do what you're doing now that some of the restrictions have lifted.
I would just say, I think in our lane, I'm nervous about the unmasking of the public in public spaces, because I think we are going to see more disease, because we have maybe roughly a third of our area that's been vaccinated, and so I think our numbers are already going to go up. I'm going to expect they're going to go up a little bit more. Restaurants are going to be more crowded. People aren't going to have masks on, and we're just going to see it, and because COVID is real and science is real, and we know that the COVID is easily transmitted, especially the new variant. And the variants now are about 50% of the caseload on testing in Kansas, and the majority of those are the British variant, and it's highly contagious. It's more contagious than the original one. So we're going to see more cases. It just is what it is. Now, that's a different public health question, because the public health has to say, what is the weight of that against, kids not being able to be in sports and the increased risk of suicide and mental health issues and mental exhaustion and cow syndrome, right? COVID weariness syndrome. And I think that what we're seeing is that right now we're saying, hey, public health issues are going to be really important, and we're going to have to open things back up a little bit more in order to address those and see how we do with this over here on the medical issues. And in my lane, I'm going to be worried, and time will tell which way we go with this.
Yeah.
But it would not surprise me if we open up, see more disease, and have to close back down again. I would not be surprised by that in the least. In fact, I semi-expect it to happen.
Yeah.
But I hope I'm wrong. And the thing that would protect us is more people getting vaccinated, because then you can open up so much more safely.
Yeah.
And if a lot of people have the disease that we don't know about, and that's distinctly possible, because we do think there are a lot of people who have not been getting tested over the last several months with mild disease because they don't honestly want to know the results. They don't want to have to stop. They don't have to restrict. And so people quit getting tested as much. So if, that may help us prevent disease for a while, but, we don't know, and we won't know until we see how things go as we open up. Yeah. So it's going to be a month before we know the answer.
So on that line, Isaac says a common talking point among the vaccine hesitant is that we don't know the long-term side effects and what those will be in a few years. So how do we respond to those
actually,
people?
we do know the long-term side effects. That's not correct. We do know the long-term side effects.
Yeah.
So first of all, let's talk about the long-term side effects of COVID. They're terrible. You've seen Anil Garmarkar on our program.
The long-term side effects of the vaccine.
No. Right. I'm going to get there.
Okay.
I'm going to get there. Trust me. But the first thing you have to establish is there are long-term side effects of having COVID-19, and they are severe, and they can occur even if you're asymptomatic, and it's 30 to 50% of patients end up with the long-haul syndrome. That's a lot.
Yeah.
So don't delude yourself that COVID-19 is safe, and even if you get it, it's just a mild case. That's just not true. The flip side of that is the long-term side effects of the vaccine. We've been using this vaccine for over a year now, folks. This is not new news anymore. The first trials, the patients are still being followed up for that trial, and people are doing great. And they've been doing great with vaccinations for decades and for generations. And what we know with vaccine is that the bad side effects come within the first 6 weeks. Even all the hue and cry about the J&J or the AstraZeneca vaccine, all the bad stuff happened within the first 6 weeks. There are no long-term side effects. People have been vaccinated for over a year. We are not seeing long-term side effects. We're not going to see those. And even if you did, which you're not, but even if you did, they would be infinitesimally so much less than the long-term side effects of COVID-19.
Yeah, I can't say any better than that. We know that the safety argument and the safety reason for hesitancy is continues to diminish on a daily basis for everything that you just mentioned.
Yeah, at some point we just have to say it's just wrong to continually focus on vaccination with paranoia or conspiracy theories. The reality is COVID-19 is terrible, and long-haul syndrome is terrible.
Okay, so speaking of long haulers, an article posted recently, Mary asked, she said last month, reported on a study which said that asymptomatic COVID cases and those with mild disease also suffer long hauler impact. Is the health system seeing any evidence of that among our long haul patients?
Yeah, absolutely we are. And we've heard people talk about that. Dr. Spikes was here last week, and she visited with us about that. And that's what we're just saying, 30 to 50% of patients can get long haul syndrome, and it doesn't matter whether you're symptomatic, asymptomatic, or mildly symptomatic, Hawk.
Yeah, and I had the opportunity to talk with Dr. Ojo last week as well, and she's one of the other pulmonologists that have pulled in because we are having such an influx of long hauler syndrome, and that's exactly what she said too. Even with mild or no symptoms, you're still having these long haul symptoms, and they can actually be unmasking and exacerbating, somewhat prior issues as well. So, yeah.
Terry, have you seen some long haul in postpartum patients?
Not necessarily per se. I think that they're probably, into other clinics.
Right.
I'm not seeing any. Not really in our.
Good. Let's keep it that way.
Right, exactly.
We have a reporter question. So Lindsay Shively from 41 asked Dr. Winicky if you can comment on possible menstrual changes post-vaccination. Is this true or not?
So we're seeing a lot of, I would say, people telling us this, but we do know that really your menstrual cycle is a reflection of your overall body and stress level. So, it's not uncommon for me to get a patient concern, or call in and say, I missed my period this month, or I had 2 periods this month. Well, I'm taking finals, grandma died, and I had to move apartments. So it's a reflection of your stress level. It's a reflection of your body. So we know that the vaccine causes some reactivity, and that those things can increase. So it's not uncommon to suspect that. We are seeing some people that have missed a period or have had 2 periods after that, but it's returning to normal.
Is it true that some COVID-positive pregnant women experience clotting issues?
So we know that pregnancy in and of itself is a risk factor for clotting issues. So it's for multiple different reasons. So prior to COVID, we always worried about pregnant women and clotting issues. We know that COVID causes clotting issues. So putting those two together, that was a concern. And our patients that were diagnosed with COVID, we had specific discussions with them, even antepartum as well as postpartum, about using anticoagulation. But luckily, we haven't seen an increased risk of those here on our campus, but we do know that that is an increased risk, yes.
And Sarah wants to know, of those 4 patients that were in labor delivery, were they asymptomatic, symptomatic, or did you find them through routine testing?
Both. 3 were asymptomatic that were found on admission testing, and 1 had symptoms.
All right. Okay, that was quick. Okay, so Jennifer wants to know, will we have enough vaccine supply here at the health system to accommodate the influx of 12 to 15-year-olds?
Well, so the 12 to 15-year-olds we have plenty of vaccine on supply. In fact, we have too much darn vaccine on supply. The state of Kansas has got hundreds of thousands of doses stored. We've got, 12, 16, 18,000 doses hanging out. We can't find ours. So you have to use Pfizer vaccine, and so I believe that we have Pfizer. We've had a lot more Moderna historically. I know Children's has really worked hard at making sure they have a lot of Pfizer vaccine. I don't think we're going to have a problem handling the influx of 12 to 16-year-olds. Yeah. In fact, I would love to have that problem, so bring it on.
Yep.
Great. Okay, so Linda says, I am vaccinated, but if I get COVID and I am asymptomatic, what are the chances I can give it to my 5 and 9-year-old grandkids?
What do you think, Hawk?
Yeah. I think from the early data we have, it's lower. It is significantly lower. There's always that risk, obviously, but it's significantly lower when you look at viral loads in small studies. They do seem to be less in people that are vaccinated compared to unvaccinated people. Also, the cycle threshold, what we use to help diagnose on PCR, seems to be lower in some other studies as well, and real-world experience, particularly from Israel and other healthcare workers around in the United States, and published studies showing a reduction in symptomatic and asymptomatic disease, but also likely reduction in that transmission. So there is that chance, but it is probably significantly lower than unvaccinated.
Couple more questions.
Please.
Okay, Jennifer says, I'm pregnant. I did get my vaccine, but what other precautions do I need to take now that people are unmasked, vaccinated, not vaccinated? I have no idea. Do I still have to live the way I have the last year of my life?
What do you think, Dr. Weinecke?
Well, I think, we were just discussing this. Are you ever going to feel comfortable going out without a mask again after the past year? But, you still recommend to keep those social distancing guidelines, I think, in place as recommended by the CDC. If you're vaccinated, those wouldn't change if you're pregnant or not. So, one household, meeting with one household could unmask. But the problem is when you're out in public, you don't know who's vaccinated.
All right, Dr. Seitz, Elena asks, can you update us on India just to raise awareness? My heart breaks for what is going on there. Do we know if the U.S. is assisting in any way? Just what can you share? What are your thoughts?
I can't tell you what all the U.S. I know we were trying to ship some doses internationally. I don't know how many we sent to India. That's hard. I just don't have those numbers. And India is a heartbreak. Hawkeye. I think what we're seeing is the result of mask mandates easing, public gatherings returning, and the spread of the British variant in a population of people who had not been that well vaccinated. They are now, I think, mandating vaccination or looking at mandatory vaccine for India as a way out of this pandemic and as a way out of this terrible crisis they've had.
Yeah, you're only as strong as your weakest link. And there are so many countries that are vulnerable because they don't have vaccination. India is vulnerable and getting hit so hard with the infection right now. There are people who are unable to go to the hospital. They are unable to even have hospital beds when they are at the hospital.
Out of oxygen supply.
They're out of oxygen supply. I know that the U.S. is trying to get materials and support there, such as oxygen and vaccines, of course. And it hits close to home with our health system as well. I was talking with one of our providers who a few weeks ago lost his father to COVID-19. And then a couple weeks ago now lost his father-in-law, and now his mother-in-law has it as well. So it's a very dire situation there. We definitely have privilege and are fortunate here in the United States to have the vaccines. We need to continue to use our fortunate circumstances and get those vaccines into our arms of our citizens as well to help prevent anything like could happen in India. So it is a very dire situation there. I think it's now second in the world behind the United States as far as deaths and cases go.
Yeah, and unfortunately for them, the numbers keep getting worse. And the way they get better is going to be to restrict, to lock down, and you're going to have to get everybody vaccinated. We know that that's the answer to the problem. And the challenge is that all the economic issues that pop up with that. But it's a public health issue, a personal health issue, and an economic health issue.
One last question?
Yes, please.
Okay. So Stacy says, do you know why we can't require vaccine? I'm fully vaccinated and I'm freaking out just going back out there in the world with people who are not, especially now that they're lifting the mandates.
Yeah, it is a challenging time, and I think the issue is because it's under an early use authorization and not fully approved by the FDA, that it's hard to do that. I don't think the United States, and I may be wrong, but if the public health crisis stays where it is, I'm not sure we'll see the government ever mandating vaccine. I'm not sure that is the right thing. But I think we're going to see, I know our health system, once the drug is approved, we're going to mandate vaccine. I mean, I think a lot of business will mandate vaccine. And I wouldn't be surprised to see, especially if the numbers continue to rise, if you want to get into big public events, that vaccine passport thing may have to have some validity, because that way the people who are going can feel safe, or at least who are in certain sections might be able to feel safe. So we'll have to see what happens. That'll be a major public health question. Yeah. But Hawkeye, I don't see us requiring the vaccine until we get a fully authorized, which we think will happen early this fall, early mid-fall.
Yeah, I mean, from a medical standpoint, it seems intuitive that would happen. We know the morbidity and mortality that it protects against. We know the benefit it has given to our employees because we have less employees out ill for that. But from a government-mandated situation and otherwise public governance situation, that's a different question entirely. But from a medical standpoint, we know what the benefit of the vaccine has done for our employees specifically.
Hey, tomorrow, COVID-19 sepsis. What is it? What do you need to know? What are the symptoms of that? Dr. Steve Simpson, who's one of our outstanding pulmonary critical care docs, one of my good colleagues and good friends, who also happens to be the president of CHEST. That's like one of the big pulmonary organizations. So he's approximately a very big deal, but we're not going to tell him that. We'll explain the link between viral sepsis and COVID-19. We're going to talk a lot about what sepsis even is and how that affects your body and why it's such a risk to you and why you want to be vaccinated so you don't have to suffer from it. Dr. Weineke, final thoughts from today.
Thanks. I think the biggest thing is vaccine, all the data that we have in pregnancy is that there's no increased risk, no safety data, or no safety concerns that have arisen from the data. So really recommending and everyone to take a look at that vaccine, even if you're pregnant, even if you're breastfeeding, and that's going to be our answer to this. So,
that is going to be the answer.
Even if pregnant, even if breastfeeding, please consider.
And just to say, thanks for coming on the program today. It's always a pleasure to have you. You guys were down into some deliveries initially, but now things have kind of popped back up, right?
Yeah. So, that initial sort of couple months of people, if you think about, that would have been pregnant in March and April, we saw, and it was nationwide. CNN reported on this last week as well, that most states had a decrease in the birth rate in the later December and January, and that would be about that time. And then in addition, a lot of infertility clinics sort of shut down as well, so we didn't have those people becoming pregnant. Concerns about the economy, concerns about COVID, etc. We are definitely seeing a rebound in our pregnancy rates. Last month, we performed the most early ultrasounds that we ever have in our history. So there is going to be a post-baby boom, I do believe.
So you're up to about 3,000 deliveries a year or whatever, is that right?
Yep, just right under.
Yeah, we were at 800 for up to 3,000, so you guys have really done a great job. You're incredibly busy and do a fabulous job up there, so thanks for all the good work.
It's a community effort, let me tell you.
Yeah, it is. All right, Hawkeye, final thoughts.
The Dr. Simpson is a big deal. He's, it's going to be awesome.
Don't tell him that. And I'm not going to be here to help rein him in. It's going to be Dr. Wild here tomorrow. I'm regretting that I can't be here with CISA.
He's got a lot of leather-bound books at home as well, so it'll be good to have him as a guest. I think the message that we're continuing to give is, certainly we know the cases are going up, hospitalizations are going up here. We know that there is a lift on restrictions and mandates. Everybody can continue to do the right thing, and that is continuing to mask and distance, and of course, get your vaccines. That is what is going to keep us safe and be able to do those things that we want to, continue to do and restart doing again as well.
And that lightsaber.
And may the 4th be with you.
Please. Oh, I like that.
And the lightsaber will not protect you, nor will the Force, but the vaccine will.
But just to say, is that anger leads to hate, hate leads to fear,
right.
Fear leads to not getting a vaccination, bad idea. Use the Force, get a vaccine, be safe. We'll see you tomorrow.